at Community Impact, we are an integrated mental health center with different modalities of treatment, looking at Reiki and yoga and group therapy, as well as individual and evaluations. Because of this crisis, we really haven't changed our focus. Our mission is to facilitate positive change within families, individuals, and the community. So we work with our juvenile advocacy group, which is the coalition that I had started 10 years ago to address risk factors among the youth, families, and community, and increase the protective factors. And we focus a lot on substance abuse as well as other behaviors.
Night. So it was at that moment that through his toxicology reports and everything else that I realized that not only did we have a major drug problem, but that this problem, rippled to the point where he could have easily killed somebody else. He should have probably overdosed that night. It's probably lucky that he rolled the car because medical staff was able to intervene. So that sensitized me to this issue more than ever. So our most pressing crisis right now is dealing with these deaths that are occurring almost on a weekly basis from opiate overdoses. So we are working very, very closely with police, fire and EMT, paramedics, as well as legislators to try to get some laws rearranged so that we can, when somebody does overdose, that we can get them into treatment or at least offer them treatment moving forward.
So we wake this person up. Now they're awake, they're alert. They refuse care, they don't want to be in our custody, they don't want to be supervised. We have to let them go. You have to let them go. So now 15, 20 minutes, half an hour has passed. Now that hidden opioid, that hidden element, the fentanyl, the oxycodones, the Percocets that are laced into this heroin are now starting to take effect. The person essentially goes back into respiratory arrest. We need to have the ability to add that into the protective custody law. We need to be able to take them to a cell to watch them, not to charge them, to watch them. And in that process, we need to engage the services of counseling, because that's where the real difference is made. Okay? Or we need to be able to take them to a hospital or directly to a treatment facility. Letting them walk down the street is not an option.